Welcome back, everybody. Zach Shelley here with Management Unfiltered and on another amazing episode. Man, I just love recording with other office managers and people in the dental field. It's so much fun. And I have an awesome guest, another one of my great friends. And I'm realizing more and more like I've been able to surround myself with some super, super awesome dental professionals. And Whitnee Baldwin, current office manager, but also a dental consultant, is making waves in dentistry. She has great systems, great accountability and follow-ups and follow-throughs. So I want to introduce Whitnee. Whitney, why don't you just tell us a little bit about yourself and how you got into dentistry?
Okay. Well, hello, everybody. My name is Whitnee Baldwin, and absolutely love everything about dentistry. It's actually a funny story how I got in dentistry, to be honest. I was working as a customer service manager at Kohl's, and I was just so over, when I say I was so over missing family time and working weekends, I was just like, okay, God, I need you to show up for the kid because this is not working for me. And so I ended up starting to apply for some jobs that I knew I did not qualify for. I knew I didn't qualify for it, but I was like, you know what? I'm just going to activate my faith on this one. And then I got a call from a dental practice, and that was 11 years ago now. And they called me, and it was so funny because it was the last week of like my manager pay. Because like I took a step down from Kohl's before I had the job because I was just like, I'm not missing no more Thanksgivings, no more Christmases, no like none of that. And so I got the job there, and from there it's just history. I remember one of my first conversations with that office manager. She was like, "So what do you want to do in dentistry?" I was like, "Well, I've been in leadership since I was like 16, so I would, would love to like run a practice." And she's like, "It's gonna take you at least 10, 15 years." And I was like, okay. And by the end of that year, I was the office manager of that practice. I didn't boot her out, Nobody be like, "Oh, you bullied her." I did not. She ended up becoming the regional manager, and I was the office manager for that practice. And yeah, the rest is just history. And I love it. I love everything
That's
about it.
awesome.
Yeah.
And no prior dental experience, right?
No prior dental experience.
So because you came, I'm going to ask you this because you mentioned that because you came from zero dental experience, which technically all of us do when we get into dentistry, right? Like before a dentist becomes a dentist, like, you know, at some point they haven't been in dentistry. We can argue that fact a little bit. Some are born into the industry, but generally speaking, at some point we didn't have knowledge of dentistry. What is your take on now hiring team members that have no experience?
Personally, I love to hire people who do not have dental experience, mainly because I don't have to retrain bad habits. Do I mind hiring somebody that has experience? No, but like I said, there's so many pros and cons. Though I came into dentistry not knowing anything, the thing that taught me dentistry is Laura Hatch. Okay, it's front office rocks. I will say that through and through. I remember the office I was at was like a real strict 30, 60, 90. And they were like, okay, you got to sit in front of this computer. You're going to do this. And if you don't pass with at least a 95, you'll have one more opportunity to take it. And then if not, then you can't stay. So I was just like, oh my God, okay. And so Laura Hatch made it so easy. And her program made it just like idiot proof. And so I was able to just get on and I learned everything to the point where when I first met her, I felt like I knew her. Like I met her in Jamaica. I was like, and I was like, "I know you." And she was like, "Oh, okay." And I was like, I felt so weird. It was like so socially awkward, but it ended up being like great. And now, like, she and I are so cool. So I just love her. But yeah, so that's how I got into it. And I would totally 10,010% recommend hiring somebody with great customer service. Because one thing that this has taught me, I can't teach customer service, right? Like, I can't teach it. You can try to teach it as much as you want, but if people don't have the personality for it, 10 times out of 10, it's not going to work. So, you have to argue and battle with the person who doesn't have a personality, the person who doesn't know what they want in life, the person who's miserable about everything. I can't hire that person. I need somebody, even if you don't know what you want to be in life, I need you to have a positive attitude. I need you to be able to say yes. I need you to be able to answer the phone with a smile on your face. If you're not a morning person, it's not going to work. If you can't take the heat that comes from patients, it's probably not going to work. So, hiring somebody that just has great customer service, I'll take them over a seasoned dental person in a heartbeat.
I like that. So before getting to that working interview, what's like the first thing you look for when you're interviewing a new potential team member to know that they have the personality? Like, what's the one thing that kind of sets it apart initially? Obviously, there's going to be a lot of factors, but there's got to be one thing that you're starting to look for.
Honestly, I look at their presence as a whole. I look at like how they carry themselves. I'm not saying that you have to have a full face of makeup and be beat to the gods and all that. I'm not saying that. But like, how are you? Like, do you smile? Like, if I'm going over treatment with you, like, one of my first things that I teach when people are checking out is you always ask the patient, okay, how was everything today? And the person is like, it was fine. I'm like, okay, you don't really match their energy. You want to make them come up to your level. So like when it comes to new people, I always just see how they are when they come in for the interview or how they are when we do a FaceTime, or a Zoom. Just seeing like, do you smile? Are you interactive? Do you have a personality? Okay, do you have personality? And if you don't have a personality, then this is not going to be a job for you. I don't need stoic.
And it's setting expectations, right? It's setting expectations for the
Absolutely.
patient, and we want to exceed those expectations. So you have a unique kind of situation where you're at because you're able to work as an office manager, but then you're also working full time as a dental consultant. So it's a really neat kind of niche there for you because
Yeah.
what's most important in a practice is that the practice runs smooth while the doctor's in the chair, because the doctor needs to be there cutting teeth, producing for the office, and you need to have a team that can handle everything else so that they're not having to handle that. So how do you set expectations for a team? Like when you walk into a new practice and you're like, all right, Whitnee Baldwin's here, like we're about to turn tables. Like, how do you set those expectations?
So typically, what I do is so funny because I walk into an office and I'm always the very first thing I tell everybody from the top to the bottom, hey, I don't want your job. I have a job. I am just here to make things better. Okay. Because most of the time when people hear consultant, they automatically are intimidated. First of all, I don't even have a personality for you to be intimidated. Does my presence demand attention? Yes, but I'm not like that person that's like, you're going to do what I say, how I say. No, we're not doing that. So typically, I walk into an office, and usually the first day I just observe. I just watch, see what the handoffs are like, see how we're answering the phone, see what the organization looks like. Do you guys even have systems? Because there's places that don't even have systems, believe it or not. What is your patient interactions like? How are you communicating? If there is immediate red flags for me, I don't wait the whole day. Usually I just be like, hey, can I show you a different way? Mainly because, again, a lot of times people don't know that they're being so passive aggressive. People don't know that they're being rude. Somebody saying, here, this is how much the crown is. Your insurance going to cover this, and this is what you have to pay. You want to pay that today? No. Okay. Because I'm going to be like, I don't want to be here. Don't sound like you want to be here. So no, I'm not going to go. But if you say to a patient like, hey, how was everything today? Because believe it or not, like patients will tell the front desk that there was a problem before they will say anything to the clinical team. They'll be like, the doctor was trash, or the assistant was terrible, or the hygienist was this. They will say that to the front desk because they feel like they can relate to them because they look like them as far as like building the rapport, and they don't have on scrubs, which is why I am not a fan of my front desk wearing scrubs because it doesn't separate you. I want everybody to be separated. So, and I want my patient to feel comfortable, like telling me, like, hey, can I just pull you to the side for a minute? Let me just say, hey, this person had body odor, right? Or this person, the doctor was really rough. Do you have another doctor? Or maybe they don't understand how the doctor communicates, things like that. So, me asking that question makes the patient feel like, oh, I can relate to her. She understands this is deeper than just her getting my money. So once I build that rapport and I built all of that, then, patients are like, okay, I trust this person. So I trust you. And I think when it comes to like selling treatment and things like that, there has to be a level of trust. And I feel like a lot of offices don't have that level of trust with patients, especially when it comes to like, oh, I called 3 weeks ago and somebody said they're going to call me back and they never did. Can't stand it. The trust is gone because now you told me you were going to do something that you didn't do. Or if you say, if you tell a patient your insurance is going to cover blah, 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 then they don't cover and they're left with a bill, then they're like, I don't trust you because you told me it was, which is why I talk about verbiage. This is what we estimate your insurance to cover. It's not a guarantee, but this is what we estimate based off of what they've given us, and just having that open dialogue with the patient, just being open with them, that's a lot of where practices are being held up. But like I tell everybody, it starts with the phone. That first phone conversation. When patients call, if you answer the phone, you're like, thank you for calling. How can I help you? I'm not going to want to come and see you because you're miserable. Okay. So since you're miserable, I don't want to come and be miserable because if there's no happiness, no joy, no, oh my God, like, hey, how are you? Whatever. Like, if there's none of that, then patients don't want to come to that. We have to remember that patients choose us. We don't choose them, they choose us. Because there is a dentist within a 5-mile radius, you're going to come across about 20 dentists, right? And all different kinds of dentists, and so you have to make yourself so impressionable that patients are like, I want to be here. I want to be a part of whatever they're doing.
100%. And you mentioned a couple of things that I tell my team all the time. Well, and one thing we always do is always ask our patients, how was your visit today? We give them the opportunity. You open that door and it's asking like, Whitney, how was your visit today? And they're like, oh, it was great. And I'm like, isn't that amazing? You can have a good time at the dentist. And they start laughing.
Exactly.
Or it's as good as it could have been. I was like, yeah, nobody loves the dentist, but you make jokes on that. You get them comfortable. You tell them like, hey, I hate going to the dentist too. Mm-hmm. Or like, oh, it's been so long. You know what? I waited X amount of years to go to the dentist too. And I'm in the dental field. You're not alone. Like you find those things to relate. And Absolutely. I tell my girls always like, hey, look at their purse, ask them if they've been on vacation, talk about their dogs, if they've got dogs, like make those connections. Because when we make connections with our patients, that's what brings them back. And then the doctor will do their own thing back there. We have one of our doctors that has like an eidetic memory and like he can remember everything and patients love that. We write notes and charts. So we're like, hey, remember to talk about their cruise on their next appointment. But the big point is nobody wakes up Monday morning like, I get to go get my teeth cleaned today. Heck yeah, dude. Like that's not I cannot pinpoint. If you do, there might be a little thing wrong with you if you're that excited to go to the dentist. Unless you've been in a situation where you finally got your teeth healthy and like you're excited about like that is a legit reason. But like nobody wakes up like pumped to go to the dentist. Like it's just not a place that people are pumped to go to. And so when we look at these, systems and presenting treatment and getting patients through the door and having good patient experience, like what Whitney's saying, and Doc, you really need to listen to this. Like when you're talking about treatment, your team might not be confident about what treatment they're presenting. They might be telling you, hey, you need a crown and a buildup, but they don't understand what a crown and buildup are. Or like when a patient says, hey, why do I need scaling or replaning? Like, what is that? They said deep cleaning. What does that mean? Get your front desk trained on clinical procedures. Even though they're not clinical, give them a guideline of what the procedure looks like, because guess what? That reduces the amount of questions, the amount of going back and forth. Yeah. And confusion and clarity. You can either be fogged out with this patient and give them way too much information or vice versa, not enough. They don't know what's going on. If I'm not confident, correct. And if I'm not confident, I know what I'm paying for, I'm not going to pay for it. If somebody's like, hey, you need this. I'm like, no, I'm good, bro. Like, have a good day.
You make a real valid point, because for front desk, like how I teach and train front desk, you have got to know procedures before you can even present anything to a patient. You have got my treatment coordinator needs to know just as much, if not as much, as the assistant and the hygienist, because the patients are going to test the person that's not clinical. They do that on purpose to see if you have as much knowledge. And if they say, okay, well, they told me I needed a root canal and a crown and crown lengthening in the back, but what's this thing they got to put on my tooth? And if you have to say, I think it's a crown, and I think, well, I say that, it drives me crazy. Like, one of my biggest pet peeves is, I don't know, let me see. Burns me up, because now the patient has decided that you're an idiot, you're incompetent, and you can't tell me what the clinical people can tell me. Therefore, I'm going to get over on you when it comes to the finances, because all I'm going to do is manipulate you the same way I manipulated them.
That factor of confidence. But the thing that makes it amazing is when you go to present that treatment, I'm like, hey, Whitney, you need a crown and build up. And then we're also going to be doing composite fillings on the other side. The composite fillings are the white ones. We don't do the metal. Your insurance does downgrade them for the metal ones, but this is the only one that we offer. So this is going to be the difference here. And if I give you that and explain to you, and you're like, oh, well, what is this crown? Well, what you have here is you have a large filling here, and we actually need to build that tooth structure back up so there's enough tooth structure for that crown to actually be cemented to. Does that make sense to you? If not, I can explain it to you a different way. And you ask the patients, did what I explained to you, do you understand everything? And some of them might be like, well, yes and no. Yes, you explained it well. It's as much as I'm going to understand. They'll be honest with you. They really will. But you have to open the door for your patients to say, hey, do you understand what I presented to you? Does that make sense? Can I answer any other questions for you? Because then when they walk out the door and they've got their appointment with them scheduled, guess what? They're not going to be calling back. Why do I need this again? What am I doing? They're going to end up coming back in and say, Doc, your front desk was amazing. They answered all my questions for me. I felt comfortable. And Doc, there's a lot of docs that listen to this podcast, and a lot of you are the office managers. Get your front desk doing this. If you don't have an OM, you are the OM, Doc. So get on board, get your front desk training clinical procedures. Have them come back and watch a couple procedures and talk them through it. Patients that are acceptable on that. It's such a great thing to do, because then they can understand, oh, that's what you do. I do it all the time. And the patients don't ever mind. Obviously, we get permission with them, but like the doctor and the front desk get to understand, even in situations where the schedule's mucky, I'll be like, hey, go back and watch how crazy it is when you put fillings side by side. And then they'll see it and they're like, oh, I get it now. He numbed. He's got to go back. And it starts making sense for the team, because you're giving practical situations for them to understand what goes on with the schedule, what goes on with the patient, the experience, how we do things, and go from there. And then you said it earlier, and this is something that I shifted right away when I started this practice, was they would say, would you like to pay today? And I'm like, whoa, back up. No.
That doesn't make sense. Exactly. We taking care of this today. Like, and the other thing about the treatment planning thing is, for all treatment planners out there, office managers out there that are teaching their treatment coordinators, it is important to have a signed treatment plan, because what I tell the patient is, after we've gone over everything, I'm like, okay, what I'm gonna get you to do you have any questions? They usually say no. Okay, what I'm gonna get you to do is to sign this, and this is saying, it's not guaranteeing that you're, binding you to anything, but it is saying that you've understood the treatment and that you had an opportunity to ask all your questions. I have them sign it. I have my treatment coordinators put their initial at the bottom of the treatment plan, and then they scan it into the patient's chart. That way, if a patient calls and says, hey, I spoke to Whitney and she told me that I was only going to have to pay $1,000, and now you're telling me I have to pay $1,500, they can say, give me 1 second, say I'm not in the office or whatever. They can, well, Miss whoever, it looks like what happened is you did go over the treatment plan. It looks like I have a signed copy with your signature on it that it does say 1587 and you signed off on it. Then the patient's going to be like, and it's okay. You didn't understand. It's okay. That's what we're here for. This is why we have signed copies, because it takes the middleman out of confusion. I hate confusion. Okay, my Jesus is not the author of confusion. So okay, I'm like, listen, big Jesus, I'm your kid, so we're not gonna do confusion. So eliminating confusion and putting a great treatment note in. When I tell you, I had trained my team so much. Your treatment note, I want to know, did they search through their pocketbook? Did they call their grandma, their mama, their husband? I want to know what happened during that entire interaction. That way, a patient can't say, no, I didn't do that. Nobody ever told me that. I can be like, oh, well, it looks like I'm in the note here, and then they're like, oh, I do remember. So, yes.
Documentation is definitely key, especially too when you're talking to your clinical team, documenting why we're doing this treatment. Because when the patient gets on the phone and says, why do I need that? Because let's all be real, guys. If it were a perfect world, all of our patients would schedule the treatment. They get it done right away, right? Like the amazing world, but it doesn't happen. So you got those patients that like 2 years later, like, well, it doesn't hurt, but why do I need it? It doesn't hurt me. And be like, well, X, Y, and Z, this is why you need it. And you're able to give a quick answer for that patient. They're going to build that confidence and say, oh, yes, I do remember Dr. So-and-so telling me that I needed to get that done. So how does leadership fall into all of this, Whitney? Because we're talking like a lot of very in-depth systems. You're walking in there trying to make changes in practices. People hate change. Like, so how do you make that? How do you make that inviting? Like, I encourage change because change, if it's done right, equals growth, and I love seeing
Absolutely.
growth. But you have to have the right approach to it. So, like, how does your leadership style fall into that? How do you get people to want to follow you and do what you're telling them? Hey, this works, but I need you to listen.
Typically, I start off with them just seeing like the kind of person I am and the personality that I have. And then I go into individual one on ones with each team member. Tell me what you're looking for. Tell me what you don't like. Tell me what you want to see changed. And so after I've had that one on one with everybody, and when I say everybody from the lowest to the top, like we are talking from sterilization to the office manager, I want to know what do you like, what you don't like. And then from there, I will meet with the office manager and the doctor, and I'm like, okay, hey, listen, this is the feedback that I've gotten from your team. Now, these are the changes that we need to make. What's the best approach? If they say, oh, I don't know, they don't like change, then I'm going to go and say, hey, listen, we're going to have a meeting. Usually I have a meeting like depending on how long I'm either at the practice or if I'm just solely consulting, because like I'll go to practices and then sometimes I just consult and sometimes I'll go into the practice. I will have like a meeting. If I'm there for a week, I'll have a meeting with them twice, when I first get there. And then, we'll have a team meeting before I leave. And I'll say, listen, these are the changes that we're going to implement. One thing about me is whenever we implement change, I always tell people we're going to revisit this in 2 weeks. I don't believe that system should be in place for a month before a conversation is had. I believe that we need to know within 2 weeks because 2 weeks gives everybody enough time to try the system, see if we can work out the kinks, if it's going to be something that can work or if it's not going to be able to work. And then that way we're able to say, okay, like, look, we tried this and this is what we wanted to do. This worked well. This did not work well. But I also put it in a sense of back on the team. And I'm like, listen, these are the changes you all wanted. This is how we have to reverse engineer to get to where we're all trying to get to. Some people want more money. Some people want more time freedom. Some people just want a good thank you. Some people want to eat. It's so crazy that in dentistry, to feeding your team, they feel like you are the best person in the world. Bringing them donuts is just like, oh my God. And I'm just like, it costs you nothing. So, getting to know what the team wants, getting to understand what the team needs, understanding what is not working well, and being able to work out the kinks of what is not working well. I also talk with the office manager and the doctor, like, okay, who are your weakest links and why? Do you have people on your team who don't really need to be on your team? Or do you have people on your team who just are not as motivated? Things like that. So we try to for me, I try to just kind of piece everything together and see what's working, what's not working, come up with a system and a plan, check back in 2 weeks, see if this is work. Well, I'll check in every week. I talk to my office managers and doctors every week. And like, hey, what's going on? What's working? What's not working? Then we can tweak a system or, things like that. But usually, so I had a pretty great success rate with teams being like, okay, yeah, whatever Whitney says, we're going to do that. Yeah, because it worked. Because I have a philosophy. I learned this from the very first office I was at. And she said to me, people lie, numbers don't, which is why I love dental intel. Because if you tell me, Whitney, we had no cancellations. We had no failed appointments. Everything was just great. We did 50,000 this week, right? And to some people, 50,000 a week is great. I have doctors who do 50,000 in 2 days. But if you do 50,000 in a week and you're used to doing 20,000, it's a big deal. So then I look at it and I'm like, you actually did only 35, which is great, but you only did 35. Let me tell you why. You had 15 patients come off of your schedule this week, which is why I'm a huge, huge stickler for deposits. If you do not pay a deposit, you do not get put on my schedule. Period. And so just having the numbers show like this is how many patients came off and this is how much you guys didn't walk out, because that's a huge thing. People will do doctors do services all the time and it's never walked out properly. PAs add up, people. If you do the PA, stop saying I'm just going to do this PA. When you see that crown, do that PA, build that PA out, things like just all the things. But just showing them through their numbers like, hey, this is where you're at. This is where you're trying to get to. This is what we need to tweak. So yeah, that's how I do it.
So as I'm listening through it, I had, kind of all kind of things I want to like chime in on, and I'll start back from a few minutes ago of, just talking about like when you're talking to the team and asking them like what they need and what they want and what their expectations are, like getting on their level so that they know like, hey, I actually care about what you think. Doesn't mean I'm going to do what you want to do. There's a difference between that, but at least taking the time and being intentional about what you're doing. And then also just giving them expectations of like, this is what we're going to implement and this is what we're going to work on. Because change, I think the biggest problem for people with change is the unknown. Because whenever we change something, they're not sure what's going to happen. But if we have a like-minded goal in mind, we have shared values and morals and vision for the practice, then we can all work together. When you implement that change, you will bring to light some things that you may not have expected, but that's the whole point, is pushing the limits, because good is never good enough. Like, you want to continue to push. Like, if you have a goal, you should set that goal 10 to 20% higher of what you're wanting to be, so you're hitting those numbers. And DI is a great place to do that, and knowing your numbers, but not just the dentist knowing the numbers, like the OM and the team knowing what you're doing, what you're working towards, and why. And then also encouraging them. We're really, really good as human beings telling people what they suck at and what they're doing bad at. But like, why not find even the little wins? Like, hey guys, today we're up 1%. Guess what? That's 1% better than yesterday. And I'm bringing that up because I learned this from a doctor, and it's a really, really good tool to use. And I've told several of my team members at one point, if they're struggling with things or trying to get better at things, he brought up this thing called the 1% Club. And what he does is every day he asks his team, what are you going to do this week? Or every week he asks his team, what are you going to do this week 1% better? And it could be as simple as like, hey, we got it. Now, this was years ago. I know I don't look that old, but I'm getting there. He had a clipboard, and he's like, it's as simple as getting a string, attaching it to the pen, and attaching that string to the clipboard, so like the pen doesn't fall off. Like, just being more efficient with that. Or I'm gonna do X, Y, and Z better, or I'm gonna chart prep my last 5 minutes or 10 minutes of the day, so I'm ready in the morning and I'm not running late. But you find something that's just 1% better, so it's something that's attainable, that is not earth shattering, that you can do, and do it well very quickly. And what you find with that is 1% adds up. If it's 1% today and 1% tomorrow, or 1% today and 1% next week, like, over time, those percentage points add up. And then what you start seeing is, hey, remember 3 months ago when we were talking about how we're doing 50 grand this week? We just did 150. We did 200. And then you start sharing like, hey, your hard work does matter. I see it. It's translating to the paper, because numbers are important. And it's what we do with those numbers makes all the difference. And it's how we treat those numbers. A lot of teams will feel like, oh, they're only worried about the top line. And to be successful, right? Like, top line's a big part of it, but there's so many other factors in it.
Yeah, it's not I agree. I totally agree with you on that.
The top line, or the dollar that the doctor brings home on the bottom line, is the result of hard work. It's the byproduct. That's not what we should be chasing right on the forefront. Is the numbers are looking at, unscheduled patients that are inactive in the practice due to just not having an appointment in the last 18 months. Do you know how many patients? I ask people all the time, I'm like, hey, I got a question for you. And, because we'll be talking about numbers, and I'm like, I'm not trying to trick you, but I just want to ask you. And a lot of these people I talk to, I know, don't use DI. So it's a little bit of a unfair advantage, but it's a problem in dentistry. And I say, hey, how many new patients did you guys have this month? And they're like, 54. I'm like, oh, that's amazing. How many did you lose? It's quiet. And they're like, well, what do you mean? I was like, well, what's your attrition? Your attrition for this last week or this last month? They're like, well, I don't know. And I'm like, so that 50 patients, the 50 new patients, how do you know that your practice is growing? What if I told you you could have been losing 90 patients out the back door and you're net negative 40?
Yeah. But you know what? The sad part is every day, well, I'm not gonna say every dentist, most dentists now are like, oh, I want new patients. I want new patients. And I always say, okay, what about your current patients? Taking care of your current patients. How many of your current patients have outstanding treatment? How many of your current patients have not been in for a cleaning in the last 2 years? How many of your current patients have family members that you know they have family members, but you haven't seen their family members? Like, what are you doing with your current? I speak about that all the time. Like when I get these new doctors, they're like, okay, I want to increase my new patients. I'm like, whoa, 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 whoa. Let's hold on. Let's talk about it for a second. Where are you at with your current patients? Because if you're not taking care of your current patients, your new patients are just going to end up being funneled into the old patients.
Yeah. Yeah. And there's a place like, obviously if you're doing a good job, like you do need to have new patients. And that's not, Whitney's not saying
Absolutely.
you don't need new patients, but like
Not at
if
all.
that's your sole focus, or if it's like, hey, you've watched all these 4 surface amalgam fillings for all your patients for the last like 3 years, like you're just like, hey, we'll keep an eye on it. Like there's cracks all over this tooth. Like it's okay to tell them they need a crown.
I had to tell her one time, I said, listen, I understand you want to be conservative. I get that. Kudos to you. However, you're doing your patients a disservice by telling them you're going to watch something that you know needs a crown. So instead of you losing the trust of the patient, because now the patient's going to end up having a toothache on Friday evening, right? Now they got to go to day and night dental on Saturday because you closed. And then they're going to have an experience there. And then they come back to you and then you're going to be mad because you're going to be like, oh my God, I should have just went in and ground that tooth. Now the patient's like, well, they said it should have been crowned, but you told me we could wait on it. Now, again, you've lost more trust from the patient. And now they're going to ask for either, hey, can you transfer my records? Or they're going to say, hey, you know what? I'm just, can you do another exam and just see what's going on? Or I'm going to just find somewhere else. Or they start to lose that trust for you. A lot, again, I keep saying trust is the major factor. If you want your bottom line number to be what you want it to be, if you want to take on more money, build more trust with your patients and have a better understanding of your team. I teach that like your team is a priority. Don't think that your team is not a priority because I can't be as efficient as I need to be if my insurance coordinator is not on her job, if my treatment coordinator is not on her job, if my patient care coordinator is not answering the phone properly, if my sterilization tech isn't keeping the instruments going, if my hygienist is in there doing too much talking or just being lackadaisical, not doing what she needs to, like, there's so many factors and we lose the focus on the factors because we're worried about the patient and we forget about our team. No, take care of your team. Your team is going to take care of your patients, and in turn, your office manager is going to take care of you. It's just like a domino effect.
Yeah. Yeah. I mean, it's just like a human body. I'm talking about when Paul talked about, church is like a body.
Yeah,
It's the
it
same
is.
thing.
It
It's the same
is.
thing. The practice got an
It
arm,
is.
it's got legs,
Yep.
it's got eyes. And when one part of it isn't functioning, the other parts are trying to compensate for that. So your practice is like a body and it needs to be functioning cohesively for them to all be running at their optimal performance.
Absolutely. Like it's so funny you said that because like when I talk to doctors and office managers, I'm like, listen, the doctor is the brain, the office manager is the heartbeat. If the heart stops working, the body stops working. Like you can't you need the heart, and the heart is your office manager, and then everybody else just plays a key intricate part of the entire body because they are your arms, your legs, your kidneys, your everything. So listen, we're right there. Okay, we're right there on the same page.
Yeah. Oh man, Whitney, this has been fun. We're
Yes,
coming
it
up on
has.
time, but is there anything you want to leave with office managers or doctors? Like one point that just be like, hey, tomorrow, like this is one thing that you need to remember to move forward and just to crush your week, your goals.
Yeah, one thing I would say is office managers and doctors in your morning huddle tomorrow, before you start going through numbers and what went well and what didn't go well, ask your team, is there anybody that wants to shout out anybody for anything they did the previous day? Because what it's going to do is boost the morale. When your morale is boosted, your team feels energized and ready to go. So if you add that crown at the end of the day, and we're about to close in 30 minutes, they're gonna be like, you know what? It's only gonna take my doctor 15 minutes to prep this. It's gonna take me about 30 minutes to do my part. I'm willing to save that extra 15 minutes because my team appreciated me. So to know, like doctors, you have no idea the impact, office managers too, you don't know the impact you have on your team when they hear you say, job well done. Thank you for doing this for me. Thank you for doing that for me. And the same thing goes for team members. Thank your doctors, thank your office manager because they do so much for you guys that you guys don't see and don't know.
Yeah, absolutely. Well, Whitney,
Well, it's
this
time.
has been a blast. I appreciate you being on the
Yes,
show.
absolutely.
This has been another incredible episode of Management Unfiltered. Don't forget to like, subscribe, and share these episodes, and look forward to seeing more and more coming out of the dental industry from you, Whitney, and making a bigger and bigger
Thank
impact.
you. You too. I'm so
All right.
excited for you. This is so dope.
Thank you. All right,
You're
guys.
welcome.
We'll see you next time.